to the increased awareness of the importance of oral health on systemic health, particularly in medically complex patients, it seems appropriate that we could review the key features of a head and neck screening exam. Hi, I'm Dr. Carol Stewart, and it's my pleasure to review those issues with you, share my thoughts in terms of the key features of an oral exam. Now, the focus of this exam will be simply to identify concerns that need to be followed up at a later time, i.e. distinguish normal from abnormal. The key features that we'll be using in terms of diagnostic techniques will be 1, inspection, and 2, palpation, looking for any changes in consistency, firmness, and tenderness to elicit a further follow-up. The extraoral exam actually begins when the patient first enters the room. You want to check for any obvious signs of asymmetry, distress, swellings, lesions, anything that appears, again, out of normal limits. That's our key focus here, is to identify any problems that need further follow-up. So I'll just briefly, usually while I'm talking to the patient, introducing myself and saying hello, do a general inspection for symmetry, eyes, ears, mandible, shoulders, and verify a lack of swelling, a lack of lesions, that everything appears within normal limits. Usually check in front of the ears, behind the ears, the neck, anything that's visible. I'll even sometimes check the shoulders and perhaps the hands. After having done so, then I like to check the chewing apparatus, make sure that there's no pain upon chewing or swallowing. Also make sure that the mandible can work freely, and I'll just palpate, put 2 fingers on the lateral poles of the TMJs, the condyles, ask the patient to simply open as wide as they can and close. Do that again. Also checking, as she does that, open once more, close, open, to see that the lower mandible opens in a straight line without deviation. Close. Check for any popping, clicking, crepitus, any noises. You don't hear noises, and there's no pain when you open and close. You want to confirm that with your patient. Now, I'd like you to clench on your back teeth. That will flex the masseter muscles. Lightly palpate them. Verify an absence of pain. Okay there? Okay. And then the other muscles I will check that have a role to play in mastication, chewing, would be the anterior temporalis. Just lightly palpate. Let me know if there's any pain. Is there any pain? No. The other component of the extraoral exam would be the lymph node exam. Checking nodes for tenderness, enlargement, firmness, or even overlying erythema is very important, as it might indicate an infectious process, disease, or even a metastasis of a carcinoma. So we'll begin our lymph node exam in the pre-auricular chain, because I usually end up in the ear area. I'll begin by placing 2 fingers in front of the ear, palpating, and usually a circular motion on both sides, again verifying that there is no pain, tenderness, or firmness. At the same time, I'll put my fingers behind the ear and check for the posterior auricular nodes as well. Also, while I'm in this position, I will check the back of the ear just to verify the absence of lesions or concerns. As I'm finishing the back of the ear, I will check for the occipital nodes by running 2 fingers, the base of the skull, and then perhaps follow up with the thumb just to validate the absence of muscle tenderness as well as enlarged lymph nodes. At the conclusion of that, I'll move on to the submandibular and the submental nodes. Now what I'd like you to do is just drop your head forward. Drop your head forward. Perfect. Close. And I'll begin with the submandibular. I usually push the tissue to one side and just pull the tissue over the mandible, and then in a circular motion, feel for any enlargements or thickenings or any pain. Okay with that? Okay. Then I'll just slide onto the submental nodes. in the center and just rotate 2 fingers to check for any firmness or nodes. If I have a concern when we do the intraoral floor of the mouth, we will check it again as well. Then I move on to the other chain of nodes, the anterior cervical and posterior cervical. These 2 nodes, chain of nodes, are in front of the sternocleidomastoid and behind it. I usually have the patient turn opposite real far so that the muscle becomes a little more prominent, and then I'll just run my fingers, circular motion, down the anterior SCM, posterior as well. Then I'll do the same thing on the other side, real far. There we can see the SCM is prominent. Check the anterior and the posterior. To conclude, we want to check the supraclavicular nodes, which are just above the clavicle. I just run my fingers along that, usually palpating in a circular motion for enlargements. Check these and do the same on the opposite side. Now then, obviously, if someone has a high shirt on, you might want to ask permission to expose this area if it's appropriate at the time. That pretty much concludes the external exam, the symmetry, the chewing, the mastication, and the lymph node exam. Upon completion of the extraoral exam, then we'll move into the mouth and do the intraoral exam. Begin by inspection with the lips, again to validate lack of lesions, pigmentations, swellings, or areas of concern. Then generally ask the patient to just try and relax their lower lip as you evert it. You inspect and palpate. Again, check for any firmness or lumps. Same on the upper lips. Then at the same time, you want to check the vestibule. Okay, open. And then that will lead us into checking the buccal mucosa, both right and left side. You may need a light. If you don't have a dental light, a pen light would work quite well. And you can check the integrity of the buccal mucosa. Again, looking for the absence of lesions, redness, swelling, or any other concern. This appears pink, smooth, no breaks in the mucosa. Now, while checking the buccal mucosa, you also need to check salivary flow. There are 2 ways to check salivary flow. We want to validate that the patient's flow is normal because it has a major impact on digestion and caries susceptibility. You want to check the parotid gland, looking at the papilla of Stenson's duct, which is at about the 2nd molar location. You'll want to palpate and milk the gland forward, visually checking that the secretions are clear and watery. Do this on both sides. Another way to also validate that there's adequate salivary flow is when the patient opens, you want to check the floor of the mouth and validate pooling in that area as well. You can also check the flow of the submandibular glands by milking forward, again, and validating that the salivary expression is clear and watery, at least not extremely viscous. From there, we can move on to check the hard and soft palate. Open for me. You'll have to ask the patient to put their head back a little bit, visually inspect the hard palate for the same things: color, consistency, lesions, and integrity of the mucosa. Check the soft palate. We'll use a sterile tongue blade. I want you to just say, ah, ah, perfect. At that point, you'll be able to visualize the tongue will drop down, the soft palate will rise, and you'll visualize the uvula and the oropharynx area. Again, looking for the absence of any purulence, swellings, or areas of concern. If the uvula deviates to right or left, that might indicate a concern that needs to be followed up. At that point in time, we want to do a further inspection of the tongue. Looking at the dorsum, we want to validate the absence of any lesions, nodules, and then we'll move on to inspect the lateral and the ventral aspects of the tongue. To facilitate that, you'll just ask the patient to stick your tongue out at me, and then you want to gently wrap the gauze around the tongue, pull the tongue to one side or the other. You want to check and palpate the lateral border, pull the tongue up, check the ventral, and again take another look at the floor of the mouth. Do that on both sides. You want to check, palpate, lift the tongue up, and at the completion of that, I will ask the patient to lift their tongue and touch the roof of their mouth, and I will check the ventral tongue in this fashion. Occasionally in elderly folks you may see pronounced veins on the lingual aspect of the tongue, which would be normal varicosities. This concludes a review of the basic procedures involved in a routine head and neck screening exam. Extraoral exam, again to recap: symmetry, TMJ and lymph nodes; intraoral, lips, vestibule, buccal mucosa, teeth, gingiva, floor of the mouth; hard palate, soft palate, and salivary flow. Upon completion of your exam, any lesions or concerns noted, obviously we'll follow up at a later date. We hope this has been helpful. This is Dr. Carol Stewart, thanking you for being with me.